I'm Henny Betancourt. I have been a registered nurse for 2 years. My first years I worked as a nursery nurse, and these past years I have been working at Texas Children in a acute floor. I'm a bilingual candidate and always to learn new skills. I love to work as a dean because my number one priority is the care of my patients. Also, and I'm very outgoing. I have a very outgoing personality, and I'm always ready to help whoever it needs it. This is my last class for my BSN, and I'm very excited to add my BSN to my resume. It has been a long journey, but I really enjoy it, and this program has helped me a lot in expanding my knowledge. So during this program, I had achieved learning outcomes, and with this presentation, I want to present the seven learning outcomes that I achieved throughout the program. The number one is practice safe and effective holistic patient-centered care in multiple settings from a global perspective by incorporating theories and evidence-based findings. This learning outcome it was achieved through fall 2017 nursing theory class. I had a module 2 discussion board on personal nursing theories, and I had also a philosophy paper done. In order to do that, I read chapters 5, 6, 11, 14, and 16 of the Nursing Theory Utilization and Application book. I had the opportunity to identify type of theories. I described how nursing theories and conceptual frameworks are used to guide nursing practice. So that's doing all that. I think I achieved a 50% of the learning outcome. And then I had module 4, ethical concept and legality of nursing practice today. That was a discussion board, and I have a DEC paper done for this model as well, where I defined evidence-based practice approaches to clinical practice, discuss legal, ethical, and regulatory concepts of professional nursing. I evaluated professional values, and through all this, I achieved my other half of the learning outcome. Number 2, support patients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death and dignity. Spring 2017, comprehensive holistic health assessment. It was a big class for me achieving this outcome. So I will say that I got a 75% of my learning outcome through module 1 and 4. They were a big draw hospital experience where I identify patients' problems, I improve my assessment skills and my teaching skills as well. Then on fall 2017, practice care for adults with compromised health status. I had module 4, care of the patient with trauma, compromised immunity, and end of life discussion board. And then I finished my learning outcome there with a 25%. I describe the natural process of death. I explain how variations in culture and religion belief can impact the end of life experience, and identify community resources for the family after the death of the family member. Number 3, evaluate patient care for patients across the lifespan based on common and complex health needs and compromised multiple health status. Summer 2017, practice of the community. I achieved 50% of my learning outcome through interviewing and spending time with my chosen community, who was elderly community assisted living apartment complex. I understood that there are many factors that determine health, such as support, community resources, the ability of the person to communicate with others. All that influence a lot on the health status as well. And then on fall 2017, I had care of the adults with compromised health states, achieving 50% of the learning outcome. Through module 3 and 4 discussion boards, I have module 3 discussion board was care of the cardio, renal, and pulmonary compromised patient. Discussion 4 was care for the patient with neurological, endocrine, and GI problems. And then discussion 5 was care of the patient with trauma and end of life. Through all these discussion boards, I was able to achieve my 50% of the learning outcome. Number 4, synthesize clinical and judgmental and judgment in nursing practice, utilizing critical thinking on nursing process, research, and evidence-based practice. Fall 2017, nursing inquiry. I had nursing inquiry class, achieving 100% on the learning outcome through that class. I had module 2. I had a quantitative research paper analyzing the major step in the research process, different between the types of nursing research, and also I use research papers as a strategy to guide the evaluation and utilization of research in nurses' practice. Module 3. I had an exercise 3. It was level of measurements and tools. I compare and I contrast the other type of scales of measurement, deciding which one I believe was the best one for me to use. And then I have module 4, quality. Module 4 was a research article where I had to find the different ethical issues and models and concerns that surround nursing research. So this class was really big about evidence-based practice and nursing research, and I believed I achieved my 100% on that in this class. Employee safe, effective patient-centered care using theories and evidence-based findings in collaboration with patients and members of the interprofessional and intraprofessional healthcare team. Spring 2017, Leadership and Management in the Healthcare System class, achieving 50% of the learning outcome. I had Module 4, Healthcare Delivery System Discussion Board, and through that module, I realized the significance in the team collaboration for a proper patient care. So everybody in the team, it is important. Then fall 2017, practice care of adults with compromised health status, achieving the 50% of the learning outcome I had left. Module 3, care of the patient with compromised neurological, endocrine, and GI functioning, discussion board, and also I have a practical reflection interview where through all these assignments I understood the patient care with compromised health status, and I developed a plan of care based on the current evidence. I applied evidence-based practice for patients and centered nursing care to compromised patient with a framework of the nursing process using legal, ethical, and regulatory parameters. Then also I describe interprofessional and intraprofessional communication and management for the compromised patient, and I use theoretical concepts to advocate care for the holistic, multidimensional needs of the compromised patient as well. Number 6, different multiple role dimensions and practice with ethical, legal, and regulatory parameters when caring for patients as a member of a team. Spring 2018, Leadership and Management in the Healthcare System, achieving 50% of the learning outcome to Module 4 discussion board, and also have a practical assignment for this class. And then fall 2018, practice care of the adults with compromised health status, achieving the other 50% of the learning outcome through Module 2, where I describe intraprofessional communication and management for compromised patients, and then use theoretical concept to advocate care for the holistic dimension and needs of my clients, patients. Demonstrate professional integrity, effective communications, and I incur service for the community. Is my very last learning outcome, and that was Spring 2018, Comprehensive Holistic Healthcare, achieving 30% of my learning outcome. During through Module 1 and 4, it was a shadow health virtual experience, and then in summer 2018, practice of the community, achieving 70% of my learning outcome. utilizing Module 1 discussion board and Module 3 disaster preparedness paper. So as you can tell, there is no one class that gave me one thing. It was a combination of all classes that give me all the learning outcomes I needed for graduation. And then now I have a 5-year career planned. In 5 years from now, I want to be a nurse practitioner. I will take a break now in the spring and in the summer, and I will start next year, fall 2019. I want to apply to University of Texas Arlington because they have financial aid available, and also it's 100% online, which is a plus for me that I because I can work. My only problem is that I haven't decided if I want to do family nurse practitioner or if I want to focus on pediatric nurse practitioner. They have both programs and both are really good. The family nurse practitioner is 46 credit hours and I can finish it in 31 to 36 months. And then the pediatric one is 41 credit hours in 29 to 33 months. So I had never worked with adults. I was thinking to do pediatric, but the difference is not like really big, like the amount of time. So I may just do family and later on I will focus on pediatric. After that, I really would like to start in a resident program because the American Association of Nurses says that that is the most recommended step for the nurse practitioner to do after, because without doing that, they have found that we can put the patients at risk to embrace a patient at risk because we don't have enough information, we don't have a specialized training yet. So they really recommend you to do at least a year of a resident program where they can train you and they can give you support during this transition period before you go by yourself. So that would be my next step, and hopefully by the end of these 5 years I'll be working as a nurse practitioner in a hospital setting.